Hello, my name is Dr. John Walker. I am an anaesthetist or anesthesiologist in Australia currently. I've worked all over the world for over 40 years and have been continually frustrated with medical records. So why did I start Anonymed? It was to solve the problems with access to critical medical information in an emergency, as the current medical record system is broken. It can take hours or days with phone calls and faxes with signed requests to release your record, which is completely inadequate when minutes or even seconds of appropriate management ensure survival and not ending in death or staying alive but with permanent brain or other organ damage. A QR code will be displayed as wallpaper on the locked home screen of your mobile phone, and scanning this will go directly to your full record, including any important documents you or your doctor choose to add. An advanced care directive or a living will, also for directing what you want done or not. For example, if you do not want to be intubated or put into intensive care as you have a terminal disease or are very frail and elderly with many hospitalizations and have had enough of these. Maybe you're on a trip to see your grandkids in Australia from the UK. A Jehovah's Witness can also state no blood products to be given under any circumstances, or with some modification like a cell saver that you may accept, as some do if it means survival or not, in severe bleeding after an accident or possible emergency surgery, for example. Anonymed will be most useful if you are unconscious or semi-conscious, unable to speak, for example, after trauma, shock from any cause. Shock is very low blood pressure, anaphylaxis and anaphylactic shock, severe asthma or lung disease, COPD, emphysema, a stroke, a brain bleed or an aneurysm, severe heart problems, sepsis, which is very common, very low blood sugar or a very high in diabetic coma, epilepsy, Parkinson's disease, Alzheimer's or any dementia, choking, drowning, electrocution, a fall, hypothermia, poisoning, alcohol or drug toxicity or overdose, animal bites or stings, anything at all, including being in a foreign country where no one speaks your language, as the record will translate into the local language by automatic geolocation, although this is not 100% guaranteed, especially if you use a VPN all the time. You may need to leave it off, except when doing banking, for example. So you should check the translation is working correctly in each country that you visit. The obsession with privacy and huge increase in medical hacks and data breaches has made it impossible to find your important data. Anaphylaxis history, allergies, major medical conditions, problems with anesthesia like a previous difficult intubation, which can literally save your life if you know about it, important medications, especially being on blood thinners, test results like electrocardiograms, ECG or EKG, echocardiogram, angiograms, CT scans, MRIs, for example, something serious inside your brain like a tumor, other radiology, abnormal blood tests, for example, liver function, kidneys, thyroid, blood counts, and many, many more. Primary care summary and specialist reports or letters from e.g. cardiologists, neurologists, endocrinologists, hematologists, hepatologist, nephrologist, gastro-oncologist, and so on may make a big difference also. Anonymed records all your important details and documents anonymously, de-identified by you, so no name or date of birth should be visible, just basic data like your weight and colour, skin tone, black or white, just helpful for ID. Birth decade, for example, 60s or a 90s child, baseline systolic blood pressure, heart rate, oxygen saturation level from an oximeter, and your blood type, which are all helpful for doctors to know in an emergency. All this information should be available from your own doctor or a hospital visit. And as you are not identifiable, there is no need to worry if records are somehow hacked or concern about who sees it, as the information is not tied to anyone at all, especially you. So it's utterly useless for them to try and steal your identity, your insurance details, your sensitive information for blackmail or embarrassment. And this information is not usually critical anyway in serious emergencies. So mental health, for example, is optional, and the same for medications, although it may be better for doctors to know that you take antidepressants or benzodiazepines, etc., for interactions and possible withdrawal issues. Similarly for narcotic drugs and psychoactive drugs, whether they're legal or not prescribed, it's all up to you. But overdose and side effects, interactions and withdrawal are all important issues. Infections like HIV, for example, are also nice to know about for medical staff, but it's up to you, as usual precautions should always be used anyway. Of course, any information is better than none, so critical things like anaphylaxis and what caused it, being on blood thinners called anticoagulants, for atrial fibrillation, for example, may all be all you need to put in your record. The most recent hospital discharge summary may also be uploaded after removing your name, etc. Cut off the top, edit the document, black out your name, address, date of birth, hospital numbers. Just leave the actual summary of diagnosis, management, progress, treatment and recommendations with no identifying data. When you join Anonymed, unfortunately, there will be 100 questions like any other medical record you're asked for at a hospital or a new medical practice visit, or even the dentist these days. In the future, you can show this for similar requests, as you will get a PDF to print out, save or send. So filling in the same information 4 times for a simple procedure like a colonoscopy may be unnecessary. It is frustrating and I think insulting to demand this every single time, but it is actually what happens for the surgeon, other doctors, the anaesthetist, anesthesiologist, the hospital, probably twice at least before you come, and on admission you have to fill it in all again, and maybe your insurance company as well. And I have experienced this myself multiple times in the last few years as a patient, and also hear my own patients complaining every day. And I cannot effect any change despite trying for years, so Anonymed may be the answer we are all looking for. It has become more ridiculous over 40 years of practice, both for doctors and especially patients. It gets more and more absurd. Generally has inflated from 4 pages when I first started as a doctor to 40 pages over 40 years. I would be absolutely delighted if Anonymed could become a personal, portable health record that you have control over, and no need to repeat yourself like a parrot 100 times per year as you get older and need more procedures. Plus, it may actually save your life and keep the same quality of life that you currently have in the unexpected emergency, if that happens one day, especially while traveling or cruising around the world, or even on a plane with Wi-Fi. It would help. So just join now and maybe save your life, as well as making it easier for medical encounters. Go to anonymed.com and start making your own medical record your way. All the best for the rest of your life.